Happening today, Central Maine Hospital is closing its clinic for good.
ArcMain's Asia Reed is live in Waterville outside of Northern Light Inland Hospital and tells us how this will impact the community. Asia?
Good morning, Jeff and Katie. Some community members have told me that this will have a huge impact on people living in this area. And if you take a look at Northern Light right now, it does appear like they're taking down those signs, starting to deconstruct some things at the hospital. The closure was announced back in March, and since then, hospital leaders say most practices have slowed down since then, and they've been working to transition patients to new care locations. The president of the hospital says they will no longer accept new emergency room patients starting today at noon, and their clinical operations will end at 5 p.m. Northern Light Regional President Marie Venue says the decision to shut down was not easy, but it was their only choice. The hospital was losing more than $1 million a month from higher operating costs, low reimbursement rates, and a labor shortage. Some Waterville residents say they will now have to travel far to get the care that they need.
That's a lot of people's jobs. That's a lot of easy medical care. One of the great reasons to live right here is because the hospital is right here.
Hospital leaders tell me that they will hopefully try to sell this property to another healthcare provider. We'll have much more on this story coming up on ArcMain around 10 a.m. We're live in Waterville for ArcMain. Asia Reed, back to you, Katie and Jeff.
You know, I'm sitting there looking at a story we did. This is right on our website that they say 10 out of Maine's 24 rural hospitals are at risk of closing. 10 out of 24, that's 42%. And what are people going to do when they live out there in some of these rural areas? I mean, we're lucky to live in a metropolitan area.
Yeah, that's the big question. And it's very understandable that people would be very concerned about where am I going to go in the case of an emergency.
I mean, think about this, you know, again, seconds matter. I mean, especially in an emergency with an ambulance. So instead of the folks in Waterville being able to go to Waterville, they're going to have to head down to Augusta, which is an extra like 10, 15 minutes. And so again, seconds matter in an emergency. So hopefully they'll figure out another tenant to come in and have another, medical facility there. So we'll cross our fingers. Hopefully that'll happen.
All right, let's bring in meteorologist